everybody. Thanks for being here. We're going to wait just for a few minutes for everybody to join in on Facebook. And in the meanwhile, I'd like to let you know that Entrepreneurship on Tap is now celebrating 10 years. And for this reason, we decided to do it differently. And we did two things. First of all, we decided to have women only this year. And this is so interesting because we now have so many women who are tech entrepreneurs in Israel. This is news. It's great news. That's the one thing. The second thing we did is that now Entrepreneurship on Tap has a younger brother or sister. It's called the Cafe Entrepreneurship, and it takes place every morning at 10 o'clock. And you're welcome to look up our program on the Global Entrepreneurship Network site. It is my pleasure to have as our guest today, well, this is the Global Entrepreneurship Week, is obviously an international program, and we're having a guest from Silicon Valley, and this is Dr. Mitzi Krockover, and she is the Managing Director of Golden Seeds. She co-chairs their health sector group, and she's a member of Women's Health Executive Advisory Team of Springboard Enterprises, which you better get acquainted with them because they can help you fund your company. Her day job is principal consultant at SSB Solutions. And Mitzi, I'm so grateful for you to coming here.
Well, thank you. It's a real pleasure to be here. So thank you very much. Before we get started, and I also want to thank you for inviting me as well as Jen Israel. This is a really wonderful program and I'm delighted to be here.
Thanks.
I wanted to start with a poll from our group and see really who the audience is. So Riley, if you wouldn't mind putting up the poll for a moment. And then while folks are voting, unless we have all the answers, I'll just go ahead and start sharing my screen. Okay, so we've got someone in the Femtech space and someone that's either in the angel investment space or wants to be. So that's great, a little bit of both. So that's terrific, thank you. So when Ayla asked me to speak, I was delighted to and to kind of get to share some of my views on women's health and Femtech because it's a very exciting sector and really is very meaningful to me. And so just as way of introduction, wanted to tell you a little bit about my path there. I'm an internist by training and previous practice, and I had the great honor in 1993, Iris Cantor, who's an incredible philanthropist, she approached UCLA where I was on faculty with her desire to create a comprehensive women's health center. And I had, again, the honor and privilege of leading that effort and later becoming the founding medical director of the center, which became a Women's Health Center of Excellence designated by the US Department of Health and Human Services. And as an internist, and my colleagues were internists at the center, we worked with our specialist and subspecialist within the UCLA Medical Center to provide care that was responsible and responsive to women, took into consideration their different needs, both physical and psychosocial, and while also conducting research and educating our medical students, our residents, and even our faculty. I was then lucky enough to be recruited by Humana, a large health insurance company, which you probably have heard of, and at the time was covering 6 million members. A majority of those were actually women, and I became vice president of women's health at Humana. And it was really just a wonderful opportunity I had been in academics and had looked and worked in clinical and research activities, but to be able to then go and impact on a macro scale was very interesting to me, and I certainly learned a lot. So we moved from Malibu to Louisville, and during that time, I supervised a high-risk pregnancy program that reduced NICU admissions by 17%, an employee lactation program, and a postpartum depression screening program, along with a host of other activities that I took on, both for women's health as well as e-health and prevention programs. So fast forward, and over the past few years, found myself being consulted for my medical expertise by a number of women's health companies. I think this is before even the term Femtech had made it on the scene. And as I saw this, and I saw these wonderful companies that were really looking to meet a need, I thought this is another way to move the needle on women's health. And I literally wanted to be invested in it. So I was lucky enough to be connected to Golden Seeds, which I'll talk about in just a moment, and learn about angel investing and become an angel investor with a special interest, obviously, in health and a very special interest in women's health. So what is Golden Seeds? Well, we are an angel organization that is dedicated to funding high potential women-led businesses for the purpose of participating in a successful financial return to our investors. So our criteria, or our basic criteria, there's more detailed criteria, is gender diversity. We look for women founders, or at least a woman in the C-suite who has meaningful position, influence, and equity, is truly leading in that space. The sectors that we focus on are enterprise services and technology, consumer products and applications, and certainly healthcare. And we do limit our investments to those companies that are domiciled in the United States. We are present in 20 states with our membership of about 300. We have 8 chapters in the Silicon Valley, Arizona, Dallas and Houston, Texas, Atlanta, Georgia, New Jersey, New York, and Boston. And I'm sure that you probably are familiar with a bit about the difference between angel and venture capital funds, but I wanted to highlight a couple of points. First of all, angels invest our own money. So we're making our own decisions for our investments. So obviously active investing. Angel groups, and certainly Golden Seeds is one of them, really looks at that early stage, maybe right after friends and family, but before Series A. I call it a little bit of an interstitial space. So obviously that's more risk than investing later on. We invest in a lot more deals than VCs, but certainly with smaller amounts of capital. And many of our investors have been entrepreneurs, are certainly professionals in their own right, and they really want to not only invest money, but they also want to support our entrepreneurs in any way that we can, and at the very least make recommendations and connections for the folks that come across us. Venture capital funds are what's based on passive investing. The general partners are the ones who make the decisions, and the limited partners have no say in the investment process, which is again, passive investment. And certainly they are investing a little bit later on in the process. So in the next 25 minutes or so, what I wanted to talk about is right here. What is women's health? Some issues around COVID and women's health that we're seeing. Femtech as an industry, and what does an investor look for in a company? And I'm talking a little bit more about women's health and COVID. It may seem a little bit academic, but if you will listen to it with the thought about where are the pain points, I think that that will become useful to you. So we're talking a little bit about women's health. So women's health issues include those conditions that manifest differently or respond differently to treatment in women. So heart disease is a great example. In medical school, we're taught that a person having a heart attack comes in with the Levine sign, that they have their fist on their chest. Women, not so much. Nausea, vomiting, maybe the pain to the jaw, maybe chest pain, but again, it's sometimes much more subtle. And we also know that there are different diagnostic tests that we need to consider, as well as treatment modalities. Certainly alcoholism is different in men than in women, everything from the metabolism to the treatment. And depression manifests itself differently in women than in men. And there's certainly issues that we need to deal with respect to treatment. Medical problems that occur more commonly in women are those like the autoimmune diseases like rheumatoid arthritis and lupus, eating disorders, osteoporosis. Many of these obviously affect men, but certainly much more often in women. And problems that occur exclusively or nearly so in women. And obviously those would be the reproductive cancers and conditions, breast cancer, and issues like postpartum depression. The other piece that affects everybody's health, and certainly women, is what we're calling social determinants of health. And you may have heard that used more and more, something that we always kind of knew, but now it's really being integrated into healthcare in order to get the results that we want and the outcomes. So if you look at issues such as the community, how's the neighborhood designed? What are the social and cultural relationships, and how do they work in that community? Is there affordable housing? What's the quality of the environment? Everything from water to air. And certainly, how do people recreate? And do they have some green spaces and parks? Certainly, economic opportunity and employment are important, which obviously impacts on access to food, education, healthcare, and transportation. Safety is a significant issue, again, especially for women. And we know that there's a direct correlation between assault and violence and longer-term medical issues and mental health issues. And as we know, policy certainly impacts women's health, probably disproportionately, and certainly then gets involved with politics. So a few others that I think are important is this gap between the research that we have on women and people of color. And this makes a little bit light of it, but says we have studies of fruit flies, mice, hamsters, frogs, monkeys, and men with this condition. But medical research using women as subjects just never occurred to anybody. And I always, tell, when my physiology book in medical school had about that much about women's health and physiology. And in 1990, or is it 1995, I believe, the NIH mandated that those research projects that were presented to them had to have ample representation so that we know what the differences are and how it affects people of all races, ethnicities, and genders. The other barrier to care that I think a lot of women can relate to is the fact that they don't feel heard or they don't feel believed. And this male doctor is trying to assuage that in terms of saying many women are more at ease with a female doctor. That's why I'm wearing the wig. Well, it's certainly not just the wig. It's really having clinical care that is based on research and based on education that may or may not have been received by that clinician, and certainly potential implicit biases as well. And I'm not trying to make a political statement here. I just wanted to make underline the issue that when we, as you probably know, Planned Parenthood, which provides abortion services, but also provides family planning, contraception, testing for STDs, sexual transmitted diseases, HIV, and some well woman care and some basic care. And that was also defunded when Planned Parenthood was defunded. And so it really did impact on the health of women especially low-income women. And so what this is showing is that, you know, there's the political piece of this around abortion, but she's saying, you know, I'm not here for the abortion, I'm here for just regular health care. And we see, again, those kinds of challenges in women's health. So I want to then look a little bit about what are some of the, again, the specific pain points, if you will, for women. And this is a study, a survey of 10 countries. Most of them are either European or predominantly Caucasian. However, and Israel unfortunately wasn't included, but I do think that we can draw some conclusions. And also, I know that the US is a big market for women's health. So hopefully that will be useful. So we know that the chronic disease burden among women in the United States is significant. And what that means is that they can have multiple conditions such as arthritis or joint pain, asthma, chronic lung disease, diabetes, heart disease, high blood pressure. So of all these countries surveyed, we see that the United States, unfortunately, is in the lead. We also are right up there with the highest rate of emotional distress and mental health challenges. And this one, to me, is the real heartbreaker. Even though the United States spends more per capita per person on healthcare, we have the worst maternal mortality rates of all of the Western and developed countries. And it's actually getting worse, not better. And when you look at some of our other communities, such as the Black community, those numbers are even worse. And so the focus on Femtech, if you will, on this space is certainly important and needed. We also have higher out-of-pocket cost. As you know, we do not have healthcare coverage for all. And so we do have that. And again, potentially related is that almost half of women in the United States report medical bill problems. More than 1/3 skip care because of cost concerns. And we have the lowest rates of having a regular doctor or place of care, though it isn't too terrible, but it certainly isn't as good as it could be. And women in the United States are more likely to visit an emergency room, again, theoretically, because they don't have that doctor or they don't have access to care on a regular basis. It's no surprise then that only about 1/4 of women in the United States rate their quality of care as excellent or very good. So again, what that means is that women are looking for other ways to get their health and wellness needs met. So just a brief word about COVID and women's health, and also a little bit about investing. We know that, and these are the United States, but we know that men and women are getting infected at about the same rates, but men have a higher incidence of death. There's a number of theories about that, but I won't go into that now. We know that the younger folks are most likely to get together and may be diagnosed with COVID, but it's the older folks, which doesn't seem so old now that I'm in some of those groups, that unfortunately are at higher risk for death, and certainly those with any kind of conditions, medical conditions, certainly increases that risk. This is just, again, to remind us that it's not a homogeneous group of people that we look at, no matter what country we're in. And so here in America, compared to Asians and whites, Native Americans, Blacks, and Latinos have a higher rates of cases and hospitalizations, and the Black population has a significantly increased risk of death. And just want to make a note that it's not necessarily saying that it's the race or ethnicity that is the culprit, if you will, but that these are risk factors for other underlying conditions that impact health, those social determinants of health that we spoke about earlier, including socioeconomic status, access to healthcare, and potentially increased exposure because of the propensity of these folks to potentially be essential workers, healthcare providers, and infrastructure workers. This really got my attention that in the time between February 1st and October 10th, COVID became the third leading cause of death in the United States. That's pretty significant. With respect to women, women are certainly bearing the brunt of mental health challenges and stress. Kaiser Family Foundation did a survey that underlined this. As we all know, women are more likely to be the caretakers, homemakers, and workers in the home. They're more likely to be an essential worker, healthcare worker, or in the service industry. Those in the service industry have had higher risks of layoffs. Those essential workers and certainly healthcare workers are feeling traumatized and overwhelmed and burnt out. And those who have not been laid off perhaps had to step away from their career path because of the other two roles that they had to play in their family. We also know that non-COVID illness is not being treated. Screenings and preventive care is not being done as much as it should be and has dropped, including vaccinations. An article in Lancet underscored that by looking at the drops in screenings and diagnoses and diagnostics, and making a prediction that if that continued, we will have more cancers, for example, being diagnosed at later stages, and that's certainly of concern. Dental care is falling behind, and we've seen an increase in intimate partner violence and substance use. A lot of those challenges provide opportunities for interventions and potentially entrepreneurial interventions. What we're seeing now is an increase in obviously spending and investment in COVID-related therapies, preventives, and testing. Today, a at-home saliva test was, I believe, approved, and obviously the great news about the vaccines is heartening, but we're also, again, going to have to treat people, try to prevent this, and so a lot of work is ongoing. I think everybody has noticed the increase in the use of telehealth, and with that, a combination of telehealth and home monitoring leading to a whole new paradigm in chronic care management. We're also seeing the use of telehealth in research trials and even in different practices such as physical therapy or nutrition or even pharmacy. We certainly need mental health solutions for the kinds of numbers that we're seeing in all the different categories, both young people, working people, as well as the elderly. We are seeing increased point of care testing and home diagnostics and therapeutics. There's an increasing demand from the consumer side that they want it accessible on their time, affordable. And so that's driving a great deal of new technology. Certainly an increase in wearables and monitors and sensors, again, feeding into the, or combining with the telehealth to really move the needle on things not only of chronic care management, but wound care management, home care, and so forth. And then sanitation options are obviously needed, and there's a lot of new technologies. And then with all the telehealth and digital health that we're seeing, there's obviously an increased need for cybersecurity and supply chain management. So in terms of investments in the last quarter, according to CB Insights, you're seeing AI deals upticking. Telehealth continues to grow. Medical devices continues to grow. Drug research and delivery technology is growing. Women's health, of course, and mental health deals reached a record high. So again, mirroring the kinds of things I was saying in the previous slide. And we are even seeing mega rounds that are boosting health plans and benefit management funding, taking care of some of those issues around doctors' bills and financing. So drilling down specifically to Femtech. According to PitchBook, Femtech remains a significantly undeveloped slice of health tech. And in 2019, the global market for female-focused health product generated over $820 million and is estimated to reach at least $3 billion by the end of 2030. I saw another prediction that perhaps it might be $5 billion by the end of 2025. So we'll see who's right. And as you saw with CB Insights, women's health funding more than doubled in the third quarter. There was a 139% increase in quarter over quarter, marking its second strongest quarter since Q1 of 19. There was a new record of 68 deals, and 2 of them were key acquisitions, and they were in the pharmaceutical space. And in 2017, I believe this is when this is from, the Femtech, excuse me, the Femtech map looked, full, but in retrospect, it looks a little small. And interestingly, and I'm not going to go into this, there are even some of these companies that are truly a little bit mislabeled, or a lot mislabeled in terms of where they land. Come over to 2020. And Fermata did this wonderful landscape map. And Fermata, if you don't know, is a company that's based in Japan that is a bricks and mortar shop. And I believe they also have obviously online capabilities of women's health products. And they're opening in Singapore as well. So I think it's a really exciting model. And I'm sure you can't read this, so I just want to call attention to some of the buckets, or all of the big buckets. So you've got mental health. I think that there's more there, but these may be the ones that are just focused on women. Sexual wellness is really taking off. Women and wellness in general. Period health, fertility solutions, pregnancy and mother care, and growing focus on menopause care. And Isla mentioned Springboard Enterprises, and Springboard is an organization that funds and supports women-led companies, women entrepreneurs in the tech space, and they have devoted significant resources and focus on women's health. And they've chosen also to define women's health in a perhaps more expansive way than we've seen thus far. And of course, that speaks to me because as an internist and all those reasons I talked about with respect to what women's health is. And the 7 buckets, if you will, are autoimmune diseases like thyroid disorders, multiple sclerosis, lupus, oncology, cancer, bone health, certainly gynecologic and reproductive health, sexual health, but also heart disease, #1 killer of women, cognitive and brain health. We're more at risk for dementia and Alzheimer's. And so they are, again, expanding their focus with respect to women's health. And so finally, what does an angel investor look for in a company? And I'm going to be general, and then I'm going to speak a little bit about health companies and some of the special issues and opportunities and challenges that one might want to be cognizant of. So what do we look for? Well, certainly we want a capable management team, but we also want to have what's considered a coachable management team. We're not always going to be right, but what we want is, but we do bring some expertise and experience in many times, in many ways. And so we'd like to know that the team is open to other ways of thinking and considering. a scalable business model with limited capital expenditure requirements. And so, let's see if, I don't know if it's, oops. So again, it's not going to be a one-off, or, you know, it's got to be able to have a large market. And as you see there, an addressable market of greater than 500 million. It's always great to have multiple streams of revenue. And if they're recurring streams, that's great. However, you also walk the tightrope about not looking too scattered and being focused. And so maybe starting with one, but then showing your plan for rolling out other streams. We're looking for a way to get our money back, so a plausible exit strategy within 7 to 10 years. And then what you might see in the health space is that we don't usually invest in very early stage, say, therapeutics because of the long regulatory process, for example. And then opportunities that resonate and can be accelerated with support from our investors and fund partners. And this goes back to the fact that, again, we have investors, men and women from all walks of life, all professions, and with really deep knowledge of different sectors, may have been entrepreneurs themselves, maybe in the financial industries. So many of them will, you know, go towards those kinds of things that they can be helpful in, or they understand that space. So when you're looking at your investor deck, at least have these 10 slides. You probably will have more, because if you've got a technology that needs to be explained, or you're dealing with a disease or condition that is not necessarily familiar with people, obviously you'll need to focus on that. I will also say that you're not going to necessarily dumb it down, but you're always pitching to folks who are very busy and may not be, again, proficient in that sector. So you can never be too basic. That will never be seen as a negative. If you help someone understand what you're doing, that's always in your favor. So we want to know, what problem are you solving? What is the pain point? Is it really a problem? Is it a nice to have or a need to have? And what is your solution to the problem? And is it an effective one, and why? Who has this problem? Who's your market? And who are your competitors? And why is your solution better? Personally, I always cringe a bit, especially in areas that I know something about, when an entrepreneur comes in and maybe doesn't have some of the key competitors that I think that they should have had. And it just makes me a little nervous. So, you know, again, you can't figure out all of them, and sometimes you may not have access to that information. But if you're in your space deep enough, you'll know who you're coming up against. And how are you better? How are you going to attract customers? And obviously, how much is it going to cost to do so? What are your sources of revenue? And what are your gross margin assumptions? And we're going to talk a little bit about who's paying for it as well in just a moment. Who is on your team, and why have you chosen them? You know, having a great advisory team with a lot of icons by their name is great, but, you know, what are they providing to your team, and how are you going to benefit from that specifically? How much money do you need? What will you do with the money? How will you spend it? And I will also say, how have you spent your money thus far? Always interesting to angel investors. How do you intend to give your investors a return on their investment? Meaning, what is your exit strategy? And if it's not a specific exit strategy, do you have another way of paying back your investors with a certain return? And there's a number of vehicles. I'm not going to go into those because that's not my area of expertise, but we have seen that in the past. But basically, you're going to want to either be acquired or IPO or partnered. And so we want to know what your plans are with that, and if you've even had any conversations. And certainly at the very end, why should we invest, right? What's What's in it for us? Mirroring some of those key focus points are the top 10 reasons startups fail. No market need, almost half. Again, that's such an important piece. Some have run out of cash or not the right team. About almost 20% get outcompeted. There are cost and pricing issues that cause some companies to fail. If your product's not very friendly to the user, they're not going to use it. Products without a business model. Great product, but what's the path? Poor marketing, ignoring your customers, and maybe just being a little too early or a little too late are all factors. So in healthcare, we like to say that we have the quadruple aim: the right care at the right time, at the right place, with the right cost. And I can show this slide later, but just know that in the United States, we spend, as I said, more on healthcare per capita than any other country, though our results don't certainly always reflect that. And it's really eating up a big portion of our GDP that could be used for other things. And so we're really focused on, again, this balance of getting the care that's needed with, again, the right time and in the right location, whether it be potentially outpatient versus inpatient, home versus outpatient, and certainly affordable. And as I said, with healthcare companies, some of the things that we look at, and again, I'm sorry to be so US centric, but again, assuming that you are probably going to want to include us in your market, we want to know who the customer is. Is it the end user that's using this app to help them manage their diabetes? Or is it the insurance company that's paying to have that patient monitor their diabetes better? And sometimes there are two, because if you can't get the diabetes patient to engage with the app, you're not going to see the kind of return on investment that the insurance company wants. So being very clear about who's your customer and who is the payer. And in the United States, the payer could be the consumer. It could be the employer who's also looking to reduce their healthcare costs. It could be the insurer, could be the government. And so a number of channels as well. We're also going to look at, does this technology, again, reduce inefficiencies? Does it improve access to care? Does it reduce costs? Does it increase the quality of the treatment that's already out there? Can it make medicine more personalized for patients? And can it help a patient or consumer better manage and track their health and wellness related activities so that that information is actionable? And I'll talk about that in just a moment. And if that information from wherever you're getting it from integrates with the health record so that the doctor can be a partner in this, or the provider, that is a little bit of a premium, if you will. Obviously, we want to know that patient privacy is protected. Also, again, health systems and providers, especially right now, are extraordinarily stressed, right? They don't have a lot of time to learn to adapt a new technology unless there's a really crushing need for it. They don't have time to train their individuals, or is it going to take time or money away from other things? So integration and ease of integration is really important to the healthcare systems and to the providers. We look at regulatory issues and delays and those things that need those kinds of things, and we look at timelines. A drug in a phase 1 or phase 2 still has a fair chance of failing, has a fair chance of needing a lot more money. And so we're probably not going to be as interested in that space as we might be in a company that's either completing or perhaps has completed a phase 3 trial. And again, are there demonstrable and actionable outcomes? Data for data's sake is interesting and important to some, But for those who are probably going to buy your service or product, they want to know, does it work? Does it cure? Does it help my symptoms? Does it help me lose weight? Does it help me manage my diabetes? Does it help my employees manage their conditions so that they're well taken care of, so that they can be more productive and more healthy, and my healthcare costs aren't as high. Medicare is certainly looking at programs in the over 65 space. But again, what's the outcome? Is it, again, reduced healthcare cost? Is it increased usage? Is it increased wellness? Is it increased productivity? Does it cure a disease? Whatever it is, it needs to be demonstrable and actionable. And finally, what's the barrier to entry? What's your, as we say, moat? And with healthcare, it's usually a patent, and also potentially, obviously, having pilots that have already been proven and tested, but also, and I'm gonna, whoops. But again, you want to make sure that you know what can cause others not to be able to either copy you or get ahead of you. So in summary, I just want to say, and excuse me for keep bumping my table, there are many problems and pain points to solve in women's health. We have only scratched the surface. Thus, there are many opportunities. And again, as I said before, many women have started these companies because they weren't getting what they needed from the healthcare system or from the consumer product area. The best companies provide a real solution to a real problem or pain point, have data to back that up, they have engaged customers, they can show a return on investment, they're operating at the right price, they can scale, and they have some market advantage, some barrier to entry. We know and we've shown that investment is growing in women's health, and there are funds that are dedicated to funding and supporting women's health companies. I mentioned Springboard, but there are a number of funds such as Portfolio, which is now opening its second Femtech fund, for example. And there's a number of private investors and boutique investment groups that are looking at Femtech and women's health, as well as some of the larger ones. There's some that are focused on maternal and reproductive health, such as Rhea Ventures. So again, the promising piece is that it's growing. And as you might have seen, there's communities of entrepreneurs in this space that are also expanding and growing. And most importantly, for investors and entrepreneurs alike, we can make a difference. You can make a difference in the health of women. And I think at the end of the day, that's potentially the most rewarding. So I'll stop there and be glad to take any questions.
Okay, so there was a question about you, Golden Seeds, investing in women entrepreneurs versus men. If we have a 100% men team, there's no point in reaching out to you, right?
Sure. So Golden Seeds was begun in about 15 years in New York, and it was really created to meet the need and the observation that women were not getting, even though they were a substantial percentage of entrepreneurs, they were not getting the funding that they needed in relationship to the men. And they weren't, even when they got funding, it was smaller amounts. And so that's why Golden Seeds was formed. What we're seeing now is certainly they don't have to be an all male team. What we really believe in is diversity and gender diversity, professional diversity, ethnicity. Those are all and have been shown to be the more successful companies.
Yes.
So what we do is our thesis, if you will, is that the individual does not have to be a woman founder, but they have to be an integral part of the company. So they have some kind, there should be at least one woman in the C-suite and has significant equity. So it's not just a, a picture on a deck. And so if you are all male, it's not a fit for us. And I will also be so bold as to recommend that you might want to diversify because your success statistics will get better. But that's our investing thesis.
A few days ago, I looked it up and I read a statistic that said that only 3% of VC investment goes to women entrepreneurs. Could this be as bad as that?
Actually, again, I know that there's all sorts of stats. In what I was reading last night, I saw 4.7, but there's still 95.3 that are not.
Terrible.
And it's surprising. I do think it's shifting as we get more women entrepreneurs, but also more women on boards, more women in venture capital and private equity.
Yes,
So
we've been seeing the same development in Israel. We had very, very few managers in high technology to start with, and very few investors. And we see the numbers growing, and we're seeing a very strong growth in women entrepreneurs, including CEO entrepreneurs and CTOs, and it's still a small number, but it's growing so nicely that it's really makes you feel that we're on the right track.
Absolutely. And I will also just point out that 25% of our Golden Seeds members are men.
Good. Men investing in women.
Exactly.
Yeah. I was surprised to find out about a year ago that in Israel alone, we have 4 heart centers that are dedicated for women only. It's amazing because we're a tiny country.
Sure.
I believe there was another question here. The question is, I know the answer, but the question is, why are you investing only in the United States?
It is a policy. I believe it's just because of it's easier and cleaner. And, it was a decision by our managing partners, and it's not, we see so many companies, that, come through or not necessarily apply to us, but that we see at different venues and events that, are so enticing, but that's how that's where we're limited. And it's really, I think, more of a logistics issue rather than anything else.
But it's not just Golden Seeds. It's very uncommon for angel investors to invest outside of home. Very unusual. So it's a general trend.
Mm-hmm.
When you spoke about the amounts of money, the very large amounts of money that are spent on health in the United States, and I believe most of the spending is private rather than public, right? Or were you referring to the public money?
It's a really interesting question. If I can just share the screen very quickly, I'll show you it graphically. And let's see if I can. So if you look at expenditures, and it doesn't divide it from commercial to government. But what does happen is that we look at where we're spending our money. And the reason why, for example, we're really trying to get, and all sectors are trying to do this, so is to get out of the unnecessary hospital care, because it's so much more expensive than doing that at home or even in surgery centers and things like that. So our big areas of cost are physician services, certainly personal health care, and obviously we've heard a lot about prescription drugs. And so those are the areas that we focus. Government administration itself is pretty low, and the net cost of health insurance is not insignificant, but I don't, I'll show another, I think I have another slide. This is why it gets a little messy. And this is why I, really, we're doing a module for our investors, because our investors, who aren't in health, sometimes need a little bit of clarity. So we have individuals and businesses who either pay out of their pocket or they pay private insurers. They also pay the government through taxes, and the government administers Medicare for the elderly, Medicaid for the poor, CHIP for children, and the Veterans Administration. And all that goes to health services providers, and that includes hospitals and doctors and others. But they also pay private insurers for their public employees' premiums. So it's a very interrelated group. And that's what I, again, was trying to mention. But to your point, Ayla, is that, I just want to show one more thing. And again, I wanted to just say thank you for your attention, and if anybody wants to get in touch with me, they can certainly do it through Golden Seeds. Let's see what it was. I think I might have lost my thought, but the government, when they decide to cover something, the health insurers follow along. So that's why, especially for those that are in the 65 plus space that are looking at, that age group, a lot of times that they can get what's called CMS, Center for Medical, oh gosh, I'm blanking. Anyhow, and they can get that covered, then that becomes something that's more covered by the other insurers. So there's a lot of cross.
Yeah, the reason I was asking this, because you're talking about a huge investment in health, and at the same time we're seeing very poor statistics. So I was wondering whether the investment goes to one part of the population, and there's a very large population which is not covered really.
We need about 3 hours for that conversation, unfortunately. It's you're right. It's not necessarily, when we talked about the social determinants of health, and access to care is so important. As you know, we have a large group of our citizens who just don't even have healthcare insurance. And so that's, again, they go to the emergency room, which is higher cost, right? There's no, baseline, well, with the ACA, for example, of what's also called Obamacare, insurance has to provide certain basic preventive services and things like that. We know that if we spent our money smarter, we would get better outcomes. And what's happening, again, is that rather than doing it as a society and a community, luckily, private groups, whether it be the employers, the insurers, or the entrepreneurs who are bringing this new technology and opportunity, are kind of working together to make those things available to more people. And that's, but you look at, like, for example, maternal mortality, it is so multifactorial, and it's access to care, it's access to, good food, it's poverty, it's implicit and explicit bias. There's just, again, so many things that go into that. And so to tease that out is very difficult, but that's why I think, again, the private sector can help push some of that.
Yes, well, it's a sign of a very polarized society. And fortunately, in this way, we're much better in Israel.
Yes.
Well, I think we covered quite a few points. I think it's extremely interesting to hear about women's health altogether, something that was totally ignored for a long time. The special needs of women were absolutely ignored, and some doctors still insist that there's no need for defining women's health, and that everything's okay. And it's also very interesting to hear about the criteria of investments, which are very similar to angel investments in other fields, but of course have the special color that is difficult well, mainly to health problems, which is such a big part of Femtech and feminine technology. So I'd like to, on behalf of everybody here and on Facebook, I'd like to thank you very, very much for this very insightful and excellent presentation. We learned so much out of this. And
great. Well, it's a real pleasure to be here. Thank you so much for including me.
And thank you for the audience for being here, and to the American Embassy for supporting us. And
Great.
thanks again, Mitzi.
Sure. Stay well.
Thank
Bye-bye.
you. Take care. Bye-bye.